So all of these people who love COVID and love the mandates and love the lockdowns and love the vaccines, typically those people are the same ones that will talk about how they want to eat the rich and capitalism is the root of all evil. But apparently they don't think that when it comes to pharmaceutical companies and Bill Gates. He's the only ethical billionaire, and pharmaceutical companies just want to make everybody healthy so we don't need any of their products. But want to show this clip from a congressional hearing because I remember at the beginning of the pandemic, so like the spring of 2020 when everything shut down and we're not going to work, there was a press conference from the public health director of Illinois, I think. And she's talking about how she wants to be very clear about what constitutes as a COVID death. And it's anybody that dies for any reason at all, but they have COVID in their system at the time.
Just want to be clear in terms of the definition of people dying of COVID. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
So if you die of a car accident or you have terminal cancer and you only have 2 days left to live, but after you die, they test you and you have COVID in your system, it counts towards the death count for COVID. It's a way to scare everybody and to make this sickness, this disease, seem much more deadly than it is. So in this clip, this congressperson is going to be talking about the hospital's incentive to go along with this and how they were actually getting more money and kickbacks from the government if they recorded something as a COVID death, even if it actually wasn't.
Regards to the sort of perverse incentive for the medical folks to claim that somebody died of COVID versus if it's an automobile accident, for instance, as long as you have COVID in your system, you get to claim it as a COVID death, in which means you get to get more money as the attending physician, hospital, whatever. And he acknowledged that the statistics he's getting from the states are overinflated. We found that the governor of Colorado, who is a Democrat, actually did a research on this and found he had to get rid of 12% of the deaths that were recorded in his state. Dr. Redfield, would you like to comment on that a little bit about the perverse incentive, and is there an effort to try and do something different in the way that these deaths are recorded so we actually have better records and better numbers, better data to go with?
Thank you, Congressman. I think you're correct in that we've seen this in other disease processes too. Early in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the DRG for HIV because there's greater reimbursement.
So this next clip takes place later on after the vaccine rolled out happened and people started dying after they got vaccinated. And there was a lot of negative side effects reported on the vaccine adverse event reporting system. So this congressional clip is now them saying, the Fauci and the director of the CDC using that same argument now that, oh, if somebody died in a car accident on their way home from getting vaccinated, they counted that as a vaccine-related death or a vaccine-related vaccine-related injury. So that's ridiculous. There's no profit motive for anybody to boost up the numbers for the number of people dying after they're getting vaccinated. Who's paying for that? Like, they clearly just showed what the profit motivations were for the people that wanted you to think that everybody was dying of COVID so they could scare you into taking their vaccine. but I'm not seeing where the reverse is true of anybody, their careers benefiting or anybody making any money off of boosting the number of vaccine deaths. But here they are trying to suggest that's what's happening.
Dr. Walensky, it's been reported by some virologists and scientists that this year around 170 people have died from taking the regular flu vaccine. The Vaccine Advisory Adverse Reporting System reported that the number of people dying after or following the COVID vaccine is actually in the thousands. Is this true? Are we having that many people die after taking one of these vaccines?
Senator Tuberville, thank you for that question. The Vaccine Adverse Event Reporting System is a mandatory system of any adverse event that happens after being vaccinated. So if you get hit by a car, tragically, after getting vaccinated, that gets reported in the Vaccine Adverse Reporting System, their system. So the vaccines are incredibly safe.